The National Survey of Children's Health is released annually by the Department of Health and Human Services. It's used by local, state, and federal officials to shape policies on the physical and mental health of children in the U.S. Reem Ghandour is the director of the Division of Epidemiology in the Maternal and Child Health Bureau for the Health Resources and Service Administration at HHS. Reem, welcome to the program.
Thank you so much for having me.
So explain the survey. Why is it done and what's it used for?
Absolutely. So the National Survey of Children's Health is the largest national and state level data collection effort that we have that tracks the health and well-being of kids in this country. What's perhaps most important about the survey is that we don't just look at kids' health kind of by itself, but we also consider the family and community factors that really can influence kids' health, whether or not they get health care, what kind of community they live in, all of those pieces that go into making a healthy child.
So, as you said, it's one thing to collect data on children's health, but what about looking at the causes of those health issues? How are you able to do that?
So that's a great question. Our survey is done annually, so it's really an annual snapshot of kids' health. So we aren't actually tracking individual kids over time, but what we are able to do, because the survey is done on an annual basis, is track trends over time. And so recently, for example, some of our researchers were able to publish a paper that really looked at increasing rates of diagnosed depression and anxiety between 2016 and 2020. Those kinds of trends give us a sense of what's going on with kids' health over time and what we might need to prepare from a policy standpoint, from a program standpoint. What do we need to do to make sure that kids are thriving?
Well, as you said, one of the changes that you made actually was making that an annual survey, because before it was done every 4 years. But one thing that's really challenging in surveys is getting people to actually respond. So how did you increase response rates?
That's a great question. We could be here for a very long time trying to answer that, but I think we did a couple of things. So the first thing is that we really tried to make sure that the survey was as tight as it possibly could be, and tried to make sure that the questions that we were asking were the most essential questions. So the survey takes about a half an hour right now if you're a parent, just sort of going through routine questions about your child. We made a transition from calling people on the phone to allowing them to complete the survey by themselves in their home, either online or using paper and pencil. And that's probably the best thing that we can do to make sure that folks are responding when they are able and sort of most prepared to kind of answer those questions.
So for the 2021 survey, you added questions to assess the impact of the COVID pandemic on children. What did you find?
Well, that survey is just out of the field. So we come out of the field in January and we're processing the data right now. We will be releasing it in October, which is pretty tight for a national survey of this magnitude. So we'll have responses for about 50,000 kids. And we'll be able to report on impacts related to access to healthcare, impacts on the family, things of that nature. So we're not quite there yet, but we'll be there pretty soon.
And in general, how do the survey results impact federal funding, if at all?
That's a great question. I would say that there's not necessarily a direct effect. So we don't necessarily have programs that are 100% hinged on this particular data source, but we found that our data certainly inform the way funding and policy decisions are made.
All right. Well, thank you so much for being on the program. Nice to talk to you.
Thank you so much.
That's the latest from Washington. Thanks for watching. If you enjoyed the video, give it a thumbs up and subscribe to our channel so you don't miss out on any future Government Matters interviews.